If you're following the government shutdown at home, you've heard me and many other Democrats talk about the critical need to extend the Affordable Care Act's tax credits. But what are those tax credits and how do they impact you? Well, in today's very first installment of Calls from Your Congresswoman, I'm picking up the phone, or in this case, the 21st century version of the phone, and FaceTiming with a literal expert on the Affordable Care Act and its impact to our communities. So I'm so excited to welcome Jessica Schubel, who is a long history of serving in the Obama administration, the Biden administration, as a senior advisor to the presidents on healthcare. Welcome, Jessica. Thank you for joining us.
Thank you for inviting me.
Yes. Well, tell us a little bit about what was it like to work in those administrations and what did you do? What were you responsible for in terms of helping to make healthcare more affordable for Americans?
Yeah, I think you can break my administration work into two buckets. During the Obama administration, I really focused on Medicaid, medical assistance in Maryland, making sure that we could expand healthcare to all adults, regardless of whether they, had a child or not, and making sure that coverage was available, accessible, affordable to them. And then during my White House period during the Biden administration, I again continued to focus on making sure Medicaid beneficiaries or medical assistance folks in Maryland had access to care. But then I started to work on the ACA, and I'm really proud of the efforts that my colleagues and I and the president signed into law, ways to make coverage even cheaper for Americans.
Then that is so important right now. And our timing of this shutdown, there are arguments that we should kick the can down the road and fund the government for another 7 days or 10 days or 7 weeks. The important thing is these tax credits are set to expire on December 31st. And in Maryland, at least, that means that people are going to receive notices from their insurers about their premiums increasing starting on October 1st. But can you tell us, what does it mean if these federal tax credits expire? What does that going to mean for the people I represent, but Americans across this country?
Yeah, so for your neighbors and constituents, which are also my neighbors because I live here in DC, 15,000 people are going to see their healthcare costs increase because these tax credits help lower their premiums every month, and they won't be there anymore. And just to put this a little bit into perspective, but if they're just think about maybe you're a couple in your neighborhood who's 60 years old, right? And they're, doing okay. They're making about $80,000 a year, but their premiums are going to go up by over $11,000. That's an annual estimation, but that is a ton of money for folks. Think about a family of four who's making about $64,000 a year, so very middle class family. Their annual premiums are going to go up over $2,500. And this is on top of already increasing costs for groceries, electricity, housing. I'm not sure how families can, maybe cut costs at the grocery store to absorb those kinds of premium increases.
I couldn't agree with you more. And Jessica mentioned the 15,000 number. That's just in Maryland's 3rd district alone. That's 190,000 Marylanders as a whole. And we're talking about millions of Americans, which is shocking right now. So I want to talk a little bit about shifting gears to not just these ACA tax credits, which are so important in the fight at the moment, but this is on top of the nation's largest cut to Medicaid because of the president's big ugly bill in July. And the healthcare system itself is extremely fragile at the moment, and it's all interconnected. So even if folks don't benefit from these tax credits, Jessica, what should they know about how the whole system could be affected?
Yeah, I mean, people are going to get sick, right? And they're going to go to the hospital whether or not they have insurance or not. And that's going to put a strain on our emergency rooms, right? If the people are just constantly in there getting care because they can't afford to go to the doctor, it's going to make your time waiting if you do have an absolute emergency even longer. For our hospitals in our communities, they're going to be taking on a lot more uncompensated care. What's uncompensated care? It's the cost of providing care to someone who doesn't have insurance. that's going to lead to hospital closures. And I know your district in particular is more urban, it's around DC, but think about the rural hospitals in Maryland. If you're out in, towards Hagerstown or Cumberland, like that's a problem, right? And, for all of us who are fortunate enough to have job based insurance, your premiums are going to go up because the hospitals are going to need more money from your private insurance to compensate or offset the additional costs that it is that they have to operate under.
So it's all one ecosystem and it's
We're,
all interconnected.
it's all interconnected. We're all going to pay more for our health care.
And as you said before, this is the worst possible time with the affordability crisis across the board: housing, childcare, energy, groceries. Healthcare is one of the biggest ones. The president just announced, oh my God, 100% tariff on pharmaceuticals from out of the country, which is just going to be a huge hit in addition to these other hits to our healthcare affordability crisis. So I just want to thank you for your life's work in this space, and thank you for making the time today. And it's a pleasure to know you, and keep up the good work.
Likewise, appreciative of your stance on this. This is very important for all of us across the country, but especially here in the DMV area.
Thank you.